I like that. It's funny because not funny, but it's awesome how you're saying how you basically got into this is, hey, if this can help my family, I can help other families. And so that's basically people helping people. So I've got some great questions here there's a lot of people that are on Facebook Live and Twitter and YouTube, and a lot of the questions that they have about stem cell. And one of the questions was, what is regenerative medicine and how is it different than traditional medical care?
Well, that's a great question because so many people don't really understand what it is. At the core, regenerative medicine is actually helping to regain function by rebuilding, restoring, and actually helping the tissue to regrow in the joint or in the area. Now, there are fields of regenerative medicine where they're actually trying to regenerate, grow organs and tissues in that nature. Now, we're talking from a joint level that we're trying to rebuild and restructure and help regain the original structure and integrity of the joint, whether it's a knee or a shoulder or a hip. And so traditional medicine approaches it from you really have an option of surgery, you have an option of medicine. So the medicines are going to try and decrease inflammation or change the way the brain interprets pain. They're not going to actually do anything to help restore or rebuild the joint. With surgery, you're taking a foreign object and basically you're taking the knee out and putting a new one in. There's all kinds of problems and issues with that. And, unfortunately, statistically, about half those work great, about half don't. So those aren't great odds in Vegas, or they are in Vegas, but not in your body. Okay. So there's just a lot of complications that come with that. A lot of people don't get full results and full response with that. And there's infections and all of those type issues that were the downtime from the surgery. There's just so many different things that complicate that. And so with regenerative medicine, we're actually trying to use the body's own natural healing mechanisms to regenerate, restore the tissue so you can restore normal function and reduce the pain levels so that you can get back to enjoying a good quality of life again. That's really at the core of what regenerative medicine. There's a lot of different stem cells, one part of that. It's one of the major parts, but there's some other things that use regenerative properties in the body to heal, things like PRP. There's some other things, but when you're talking about a joint, if you're facing surgical type issues, knee replacement, hip replacement, shoulder replacement, then stem cells, you're going to have to talk about the stem cells are kind of the peak of the regenerative therapy process. And they do a fantastic job. We're just seeing some amazing stories come in on how well patients are doing and avoiding the surgeries and being able to get back to doing what they want to do. So
awesome. I like that. Another one is, what exactly are stem cells and how do they play a role in regenerative medicine?
Well, the stem cells are at the core of the regeneration of the body. Stem cells are an undifferentiated cell in the body. Without getting too complex with the biology of all this, they're a cell that basically we use, what we're talking about are called mesenchymal stem cells. And mesenchymal stem cells are undifferentiated, which means that they don't have a purpose yet. They haven't been designated. A lot of the other cells in our body, we have muscle tissue, or we have a bone tissue, or we have a nerve tissue, or a tissue for the heart, or tissue for the gut, or for the skin, whatever it is. A stem cell is an undifferentiated cell, so it hasn't got a purpose yet. It hasn't been told this is your job in the body. And so it can literally become, the mesenchymal stem cells can become literally any other kind of stem cell in the body. So they can become other tissue. They can become cartilage in a joint. They can become a ligament cell or a tendon or even bone. So they can actually be differentiated into other tissues. Now, there's multiple properties about the stem cells that make them very unique and make them very powerful. At the core, they're anti-inflammatory. And anytime you're talking about pain problems in the body, you're always talking about inflammation issues as well. And so that helps to decrease inflammation in the body, and they are very naturally anti-inflammatory. They also help to slow down apoptosis, which is cell death. So we're always in a process in our bodies of regenerating and degenerating. So our cells are always being broken down, and we're always rebuilding new cells. Now, the problem is when we start breaking down faster than we are remodeling and rebuilding in our body, then we start to age or see a degeneration or a breakdown or a decrease in function. So as long as we're regenerating faster than we're degenerating, we're staying healthy. And so if we can slow down cell death, then that actually allows us to speed up the rate at which we're regenerating, and so we can rebuild the tissues. So that's another thing that they're very good about. Now, one of the most powerful things about them is the fact that they actually also differentiate very quickly. They can become another stem cell, or divide and create another stem cell very quickly. And that's where the value for regeneration is because these stem cells multiply very quickly. So obviously more quickly as we're younger, they're much more metabolically active. So a stem cell will basically replicate about every 28 hours in a newborn or a child. And so by the time we get to be about 50, that's slowed down and it replicates about every 58 hours. But they're still replicating. And the replication produces more cells, and those stem cells can now become other tissues. So they can become stem cells, or cartilage cells, or ligament or tendon or bone or whatever they need it to be. So the stem cell, the fact that it can produce more cells and newer cells of whatever it is we need, if we've lost cartilage in the knee and we're trying to produce more cartilage, those stem cells can actually, once they're introduced into that area, the body's innate intelligence begins to communicate and tell the body what it needs to repair and regenerate that region. That helps the cells then to differentiate into whatever kind of tissue they need to become. So.